Unit 9 Biologic Response Modifiers. Biologic response modifiers are used with a variety of conditions to elicit beneficial responses from the human body. A brief review of immunity is presented, and selected agents which are used to treat disease processes and illnesses along with applicable lab tests and patient education are discussed. Here are your objectives, and this is your reading assignment. So it's chapter 47. So let's review. Tumor antigens. Tumors are actually not foreign, so usually it comes from within our body. So they come from normal cells, and so what happens is there's some DNA and RNA mutation and sometimes causes uncontrolled cell growth. So tumor antigens are basically markers that signal the immune system that cells are a threat or something is abnormal in those cells. So the tumor chemical markers on the cell surface are expressed as abnormal, so they are labeled as tumor cells and that they are abnormal. Antigen is a term that we use to describe substance the body recognizes as foreign. So there are two major components of the body's immune system. We have humoral immunity and cell-mediated immunity. Humoral immunity originates from the bone marrow that produces our B lymphocytes or B cells, and then they differentiate or mature into plasma cells, which are type of white blood cells, which produces antibodies. So antibodies have the ability to bind and inactivate antigen molecules. Those antibodies are often referred to as immunoglobulins. So there are glycoproteins or blood proteins. Monoclonal antibodies is when a plasma cell produces identical antibodies. So there are 5 major types of naturally occurring immunoglobulins. We have IgA, IgD, IgE, IgG, and IgM. These immunoglobulins have different functions. Some things that you have to remember about these different immunoglobulins is that IgE is mainly elevated after an allergic reaction, and at times it's also elevated as a response to a parasitic infection. So IgM and IgG, if you ever pay attention to your titers, so let's say your hepatitis titers, you can see IgG or IgM. IgM is usually elevated when there is a recent exposure or infection, while IgG is usually elevated after a long time. So it takes some time for this IgG to go higher. When it comes to determining if, let's say, somebody has a certain illness or an active or a history of, sometimes we look at the IgM and IgG. So whenever the IgM is elevated, we can sometimes determine that this is a recent infection or exposure, while IgG means that it's been a while since that exposure or infection. So some plasma cells become memory cells, so they remember an antigen and then the response gets stronger and faster with each exposure. Cell-mediated immunity is basically mediated by the T cell function. So this comes from the thymus. So the thymus gland releases the T lymphocytes or the T cells. There are 3 types of the T cells. So we have the cytotoxic T cells. So these cells directly kill cells or lyses the cells. T helper cells control the immune system, and so it directs the action of the system. It is the master controller of the immune system, while the T suppressor cell does the opposite of the T helper cell. So it aids to limit or control the immune response, so it helps to prevent autoimmune disease. A healthy immune system has about twice as many T helper cells as T suppressor cells at any given time. So when the T suppressor cells are overactive, that can be responsible for clinically significant cancers because it allows tumor to grow beyond the immune system's control. Biologic response modifier drugs or BRMs, they have different functions. So mainly they alter response to cancer, inflammatory, infectious, or autoimmune diseases. They also stimulate or suppress immune response, and there are some that are hematopoietic or immunomodulating and biomodulators. Hematopoietic basically aid in formation of various types of blood products, while immunomodulating enhance or reduce the immune response, and biomodulators causes something else to change or alters the host tumor interaction, so changes in the tissue or cell. Biologic response modifiers mechanism of action. So this is something that you have to remember for this course. Again, this is very important for you to remember. Something that you have to remember about the biologic response modifiers mechanism of action is that they enhance or restore function of the immune system. In addition, they can have toxic effects causing lysis of tumor cells. And lastly, they modify tumor cells, making it more difficult to survive and replicate. colony-stimulating factors, CSF, or hematopoietic drugs. So these drugs are not toxic to cancer cells. However, they are beneficial for the treatment of cancer. So these drugs are genetically engineered. So this is from recombinant DNA. The way they work is by binding to the cells in the bone marrow, which regulates stem cells or growth and differentiation of the different cells. Afterwards, it helps produce more white blood cells, red blood cells, platelets, and so on. So this helps increase or stimulate the production of these different kinds of cells. So the uses of function of colony-stimulating factors include decreasing in bone marrow recovery time after bone marrow transplant, and they also allow to continue chemotherapy because this allows higher doses of chemo to be given because it limits the side effects of chemotherapy drugs. Now, it also decreases the duration of chemo-induced anemia, neutropenia, and thrombocytopenia. So anemia is basically a decrease in red blood cells, neutropenia is a decrease in white blood cells, and thrombocytopenia is a decrease in platelets. In addition, it increases production of white blood cells, red blood cells, and platelets. So patient education. So some side effects include muscle aches and bone pain. Especially if you think about it, right, we're stimulating that bone marrow to produce more cells. So it is expected for patients to experience these side effects. They can experience bone pain, joint pain, and muscle aches. In addition, they may also experience flushing or redness in the skin because there's more blood circulating. And locally, if we inject it subcutaneously, these medications can burn or sting. And again, since we're stimulating more production of blood cells, red blood cells, white blood cells, and platelets, right? So if we have more circulating cells, it can actually affect the blood pressure. It can actually increase the blood pressure. Therefore, it is very important to monitor blood pressure when a patient is on this medication. Examples of drugs that you have to know under this class include epoetin alpha, oprilvecin, and filgrastim. So epogen or epoetin alpha actually helps increase red blood cells, and oprilvecin or Numega helps increase platelet levels, while filgrastim or Neupogen helps increase white blood cell levels. Something that's very important to remember when it comes to Neupogen or filgrastim is that this should not be given until 24 hours after chemo because it's so short acting, and if we've given chemo recently, it may not be as effective. As you see here, Epogen and Procreate, they're basically epoetin alpha. They're the same except they're from different manufacturers or brands.